Josie.
Too awkward on camera.
Hi, my name is Avery Pennington and I am giving an informative speech over the 4 different types of dementia. So when we think of our elders losing memory, we automatically associate it with Alzheimer's. And while that is true in some cases, there's probably around 7 different kinds, but there's 4 major kinds, Alzheimer's being one of them. And this topic is important to me because the women in my life, they have like the tendency to have dementia. Like my Nana's sister died of it. So today I'm going to be talking about the 4 different kinds of dementia, a summary about each of them, and also the treatment for each. And then I have a video to show you. So the first kind that we're going to talk about is the Alzheimer's disease. So this is the most common type of dementia. It's what everyone mainly associates memory loss in elders with. The second kind is vascular dementia. It's also known as multi-infract dementia or post-stroke dementia, and it is the second most common cause or type. Lewy body dementia is the 3rd most common, and it is also called cortical Lewy body disease or diffuse Lewy body disease. So, and the last kind is frontotemporal dementia, and it is it's pretty fairly rare, and especially people older than 60, and I'll get more into that in a little bit. So with the Alzheimer's disease, this type of disease happens in it's more closely related to your cerebrum, which is your learning process. It's the biggest part of your brain. And some symptoms include disorientation, confusion about where they are, not knowing who your family members are, and when it gets really bad, it's hard for the patient to swallow. They have trouble talking and trouble walking. So the second kind we talked about was vascular dementia, and it is caused by a stroke. The brain has an abundant amount of blood vessels, which makes it very susceptible to damage. If something were to happen, it's really bad because there are a lot of blood vessels. And the major blood vessels can be blocked by the stroke, which could not let everything run the way it's supposed to, causing damage. The 3rd kind, the Lewy body. So our cells deposit proteins, and these Lewy bodies, they develop in the nerve cells, which involve your thinking and your memory and movement and all of that stuff. So people with Lewy body disease may experience visual hallucinations and changes in alertness and attention. So the frontotemporal, this one, so your frontal lobe is right here, and your temporal lobes are kind of like on both sides of your ears. So this one, a lot of your language problems are here, mood and personality changes, which you see that in all of them. But according to the doctors at the University of California in San Francisco, frontotemporal dementia is the most common dementia disease for patients under 60. And then Alzheimer's is more common after 60. So here's a video over.
Memory loss, personality changes, a shrinking ability to do daily tasks. It's not easy to watch a loved one suffer from dementia. It's also not easy at times for doctors to know exactly what kind of dementia a person may have. That's because there's not been a test that can differentiate between, say, Alzheimer's disease and Lewy body dementia. Now, researchers at Mayo Clinic have developed a new way to look at the living brain and more accurately tell what type of dementia a person has. And this may help get patients on the right treatment. At a distance, these scans look like typical pictures of a brain taken during an MRI. But at closer look, they reveal information researchers used to only get during an autopsy.
We're mainly looking at the 3 common causes of dementia.
Dr. Prashanthi Vemuri says those forms are Alzheimer's disease, dementia with Lewy bodies, and frontotemporal dementia. She's developed computer software that, when used in conjunction with standard MRI, allows doctors to better differentiate between these three diseases. Without the help of this technology, the diseases can be tricky to tell apart. And that's a problem because some of the medications used to treat Alzheimer's may not help and may even be harmful if you actually have dementia with Lewy bodies. Dr. Vermurray's technology lights up the parts of the brain affected by these three most common forms of dementia. You can see the differences between Alzheimer's disease, dementia with Lewy bodies, and frontotemporal dementia. And while at this time medications only treat symptoms and not the underlying disease, Dr. Clifford Jack suggests that will soon change, and this new technology may be key to getting people on the right medications.
It's quite reasonable to suspect that at some time fairly soon there are going to be treatments that either slow or arrest the underlying disease process that is causing these clinical symptoms.
And when these medications become available, Dr. Jack says doctors can use this technology to help them figure out which disease to treat so they can better care for their patients. For more information on different types of dementia.
Okay, so I know in that they kind of talked about how frontotemporal and Lewy body and Alzheimer's were the main ones, but I mean different studies are going to have different outcomes. So a quote that I found from Bob DeMarco, he was a professional football player. He says, "When someone living with dementia believes something is true, it is true, just in Alzheimer's world." It was kind of just like a little funny thing. So today I talked about the 4 different kinds of dementia, the treatment for them. So there really is not a cure to dementia. I mean, you can catch it early and you can take medicine to slow the process down, but there's nothing to make it go away. So today I talked about the 4 different kinds of dementia and how, a summary of each and kind of how it plays out in the body and the treatment. So I hope that you take away from this speech that even though somebody is losing memory, especially our loved ones, it's really important to make all the memories we can with them. So.